I want to drop the line. Give me 3 words to tell us, to describe what you do without telling us what you do.
Dynamic airborne chaos.
I like that. I like that. And whenever I think of the sky, I think of pure chaos. I mean, I hate flying, so I give you total credit. So, of course, what made you have the change? So, tell me a little bit more about your background, where you were before you were in the sky, and what made
Mhm.
you change from Florida.
So I started my career in the ICU. So I was an ICU nurse for 3 years, and I will say that that is not enough time to have really enough training to make that transition. But I think what set me apart potentially and other people kind of in my same boat as far as years of experience goes, I think I had the right attitude and I think I came in very humbled very early. I was acutely aware that my coworkers or my new teammates were very beyond my senior. So I knew I had to work about 10 million times harder than other people to make it in this space. But yeah, so I was an ICU nurse first for 3 years and I went straight into the ICU as a new grad. I did not let the narrative of you can't start in the ICU as a new grad deter me. I was very determined very early on to make my mark in emergency or critical care in some way. I had a couple of mentors along the way. A family friend, Dr. Bishop, was very integral in my choice of specialty early on. I actually shadowed in the ER, and my first real patient contact, I think I was 18 years old, was a cardiac arrest patient in the trauma bay, and I watched them work the whole thing. And for whatever reason, I was absolutely mesmerized. And that's kind of what lit the fire underneath me to pursue either emergency or critical care. And then in nursing school, I had a professor that was a flight nurse. And I was, again, mesmerized all over again. And then in my ICU job, my primary preceptor was also a flight nurse. So I really
Oh, wow.
had a lot of insight probably into the world just because I had a lot of great mentors along the way. Because I feel like I hear a lot about how people don't know about flight nursing or don't know what transport is because it's not really talked about in school, for a good reason, because you're not going to go from nursing school to flight or transport right out the gate. Absolutely not. That's not safe. So I think that's probably why, but a lot of people don't know what it is. And so I feel like I was really fortunate to have people in my life, in my career early on, who really formed me into the nurse that I became to make that transition into flight because I wanted to do flight ever since I was probably like 20 when I kind of made that decision. And I graduated nursing school at 22. And then when I was 25, that's when I made the transition.
Yeah, that's awesome. You're a total go-getter for doing that because, like you said, I definitely didn't know much about flight nursing whatsoever. Never heard of it in school. I think it's really only until I was in the hospital working as a nurse that I would see, the helicopter and be like, how do those people get that job, Like,
Right, yeah.
yeah. So unless you're really exposed to it, otherwise, it's really not out there to learn about. So most of us think of a helicopter and chaos, like you said, but how would you describe what you do? What's a typical day in life?
It definitely is chaotic. That's a great word to describe what we do on transport, just because we do have limited resources. But kind of a day in the life, it really depends. Like every day really is so different because you never know where you're going to go and what type of patient you are going to be in contact with. You have to be very comfortable with switching from one call is going to be, let's say, a polytrauma, and the next is going to be a sick sepsis patient. So you have to be very comfortable in your skills and very okay with switching your mindsets from like complete opposite types of patients. And you have to just have a really good nursing foundation as well. But again, like I said, I can run up to maybe 5 calls in a day, or you can run one. So it really just depends, and you really have to be ready for kind of anything and everything that could possibly happen in a 12 to 24-hour period.
So now that you're saying this, so you just said 12 to 24-hour period. What are the is the typical length of a shift for a flight nurse?
So it kind of depends what agency you're in. A lot of the agencies will run 24-hour shifts. So, you know, you sleep when you can, you eat when you can, just because you never know what the night is going to bring you. A lot of spooky stuff does happen at night, as I'm sure we are all very aware that, full moon phenomenon is also true on our end. So is Friday the 13th, so it's all of those same superstitions, I guess, that, us ER and ICU nurses and just nurses in general have still exist. So you never really know what a shift is going to bring you. You just have to take care of yourself in the interim to make sure that you are ready, sharp, rested to the best of your ability, fed to the best of your ability. So, or you can work 12s. I've worked 12s also. And a lot of the times those companies are hospital based, so they kind of follow the shift of the hospital. So it just kind of, and some people run 48. So it just kind of depends on the region, the agency, if you have a hospital affiliation or not, if you're a private company, if you're nonprofit. So it just kind of, there's a lot of different factors that come into play there.
Okay. So I am actually completely clueless on what your typical day is like. Like, clueless. There's misconceptions, I'm sure, about maybe flight nurses sitting around and waiting for a call,
Yeah.
especially on 24-hour shifts. Now tell me, debunk that for me. Like, tell me, what is it like? Where do you guys stay? And then do you fly back to that location? Like,
Mhm.
how does that even work?
So we report to base or wherever your helicopter is, and there's a lot to do at the front end of the shift to prep for potential flights and calls. So you are checking your packs. So all of your packs have all of your equipment, all of your airway equipment, all of your medications that don't need to be expired, all of your fluids. You have to make sure your pumps are all charged. You have to make sure your vent is charged. You need to go out and do aircraft checks at the helicopter. Make sure the helicopter is appropriately stocked. You go and you meet with the pilots. You get a weather check. You get any maintenance updates. You get if there's anything that could potentially arise on the aviation side, we will brief about that at the beginning of the shift. And then, sometimes we'll do like skills checkoffs, competencies, education. There's also a misconception out there that we don't chart. I did hear that at a hospital that, oh, the flight team is so lucky they don't have to chart. And I was like, oh, that's so interesting. I'm like 4 charts in the hole. Like I need to, just from back to back calls, and I have to chart pretty much every charting system's a little bit different, but it's like the charting system that I was using, it was kind of like a blank slate essentially, and you put in like your times, your meds, like all your interventions, your vital signs, everything like that. Like you are like, it's like a narrative. And it takes a lot of time because those charts need to be accurate, timely, and submitted within 24 hours. And sometimes those charts take a long time if the patient is very complex or if you had to do a lot of interventions on the flight or the transport. So it's very involved, especially if you have a super busy shift and you're backed up. You could be charting for quite some time. So we'll also catch up on charting. And then we get a call and then we're off to the races. So that we sit around waiting for a call, you know, I kind of let people think what they want, but like that's not really like
You're
some
here
days
to
obviously yes.
clarify.
Yeah, like some days obviously yes, like are more relaxed
Yeah.
than others and you're not running all day, but there's a lot of prep that goes into an actual day to ensure patient safety, crew safety, because at the end of the day, like we're the ones that are controlling like this equipment and operating it and giving the medication and stuff like that. So we need to know that all of our stuff is there accurately counted and not expired and with us. Because forgetting equipment is not a fun, it is not a fun thing. It has happened to me. It has probably happened to several other flight clinicians as well. Human error happens, but you
Right.
that's what that kind of initial start to the shift is making sure that you have everything.
Right, that's so imperative because you're not in a facility. You can't just, call on.
Right, and that's the thing. We have limited resources, so we have to know that we are stocked appropriately to care for each patient that we come into contact with. So typically for me, it's been myself, the nurse, and then I have a critical care paramedic partner. Some teams will run with a respiratory therapist. A lot of those teams are the neonatal teams that they will operate more with an RT as opposed to a medic, but most teams will run a nurse and a paramedic as a pair, which works out really well because the nurse has kind of the intra-hospital ICU critical care background, and a lot of the medics have a critical care background too, but then they come with kind of that pre-hospital mindset. So having both of those minds together on a call, because I only do it's called IFT or interfacility. I'm not one of those like cool kids that does like the scene stuff on like the side of the highways and stuff. But that's what, the medic
I
really
wouldn't
brings.
know the difference.
The medic really brings like that like pre-hospital immediate resuscitation mindset, with all of the skills that come with being a medic as well. So the team dynamic works really well between the nurse and the paramedic, in my opinion.
Right. Now, let me ask you. I noticed you're a nurse practitioner. Your role on the flights is as an NP or as a registered nurse?
No, just as a registered nurse. So I actually just graduated NP school from UM, yeah, like in August. So I'm still searching for that job, but um so there aren't very many. There are some teams that do function with NPs. I think they're more up in like the Midwest region, but I'm pretty planted in Florida. Um, so, I think the great thing about like the company that I work for now is I do have, hopefully, knock on wood, that I'll be able to kind of work per diem for my flight company, and then once I land that NP job, work obviously full time as an NP, and then kind of per diem for my flight because I love transport. It's so much fun. I always say it's the best part. It's the best parts of nursing that you get to do. And it's really scary, but it's really exciting. And that's not something that I want to let go right now or in the
Right,
near
right.
future.
Yeah.
So,
I mean, it's hard to go from like such high adrenaline to really anything else. I mean, I think that's the highest of adrenaline there, being in the
yeah, there
sky
is,
with
because again,
projector.
like it's not always like this super critical, like, sometimes it's a distance thing, and, sometimes there are multiple factors that go in. It's not always this like super, now, sometimes or a lot of the time it is. However, it's not always this like crazy rush, but when it's a crazy rush, it's a crazy rush. I mean, I was just like, this is so cool. Like, I didn't really like the fear didn't really it didn't really affect me. Like, I'm thinking back as my first flight was back in late May or early June of 2021. And I just remember being like, man, this is like the coolest thing I've ever done in my life, you know? So I definitely, and I had never ridden in a helicopter before, so it was definitely kind of a gamble because some people cannot tolerate the motion. Um, so I think I was very fortunate that that does not affect me really at all. So I would definitely say if you do get motion sick, that is something you need to consider. Because if you do hit some turbulence, especially depending on the airframe that you're in, you will feel it more than others. But I just remember being like, this is exactly what I hoped that it would be, to be honest.
Just like fulfilled all your dreams.
Oh yeah. Oh
Oh
yeah.
yeah.
I
Oh
was
yeah, that's
living. I was
awesome. I was
25, bright-eyed,
25, bright-eyed,
bushy-tailed, like
bushy-tailed,
I
like
was living.
that's awesome. So, in instances where you got to stay calm and you're like, there's so much stimulation in some of those, really critical situations. How do you stay calm? Is there a trick to it? Like when you're not even on the ground.
I think for me, I just focus on the task at hand, and the task at hand is getting that patient to the best of, our ability. I say our because it's you and your partner, to the best of our ability safely to the receiving. And that's why we practice and do all these simulations because you are only as strong as your training. And those reps count and they matter. And I think in those situations where it seems so chaotic and like your heart rate's like, if you feel like it's like 200 and you're, sweating and you're trying your best, you've got to fall back on that training. And I think that's what keeps people calm is knowing that they've done the reps to for this situation in particular because it's a lot of training. Like it is a lot of training and it's a lot of simulation. I think simulation is everyone's worst enemy, but I've really grown to love it over the years because you remember sim, you remember your sim patients, and sometimes they really, it's weird. I feel like I'll get like my sim patient is like my real patient like a week or two later.
Oh, really?
So
Oh my God.
yeah.
It's like deja
So
vu.
it's you're like, okay, like we've done this before. So I think that's what keeps me calm personally is that okay, this is happening in front of me, but I have all of these tools filed away that will hopefully get this patient safely to the receiving. And I think just always having that mindset of patient safety first is also really important because it's like we're doing it for them, so I think that also kind of like weirdly keeps me calm because I'm like, I'm taking care of you and I'm focused on you. Like, I'm not focused on like how I'm feeling, I'm focused on my patient in front of me and my partner.
My partner. Right. And I think that's such a key to being a great nurse is when you're able to, really put aside your feelings for the situation because you're there for that patient. And the other thing I think of when you say that, so a lot of us are like, oh, I hate sim lab, right? Like in nursing school, we have like these ridiculous case studies, and it's like, oh, for God's sakes.
Uh,
But in your situation, I don't think there are a lot of other specialties that have so many sim
mhm,
situations. Correct me if I'm wrong, but um, for the most part, it's either like, you have like your skills classes and
mhm.
whatnot, but it's not always like so case scenarios or with a sim, in a sim situation. So it makes total sense that when you practice these things, it's building your confidence for the moment of. Right,
Yeah.
so that's really interesting to hear it that way. Um, so it sounds like some personality traits that you need to be up in the sky to be a transport nurse is to be like you definitely have to be courageous. You're brave alone just to
Mhm.
be in that helicopter. What else would you say?
You have to have a lot of grit. You've got to be gritty. And I think by gritty, I mean like tenacious and ambitious because it's you and your partner, and that's it. And you have to be willing to kind of step up in those situations because if you guys don't step up, no one is. And I think that's There's nobody else with you. There is not a doctor with you. There is not a soul with you. It is the two of you up there in the air by yourselves within potentially, probably ICU level of care type patient. You have to be able to effectively communicate with each other. So you have to be a good communicator. You cannot have an ego at all, because if you bring your ego with you, sorry, dog barking in the back. Um, Ultimately, like, that patient is going to suffer if you're not able to put your ego aside and communicate effectively with your partner. Because if you both have an ego, then you're never going to agree on a plan of care for your patient. And that is very dangerous. I also think humility, huge, 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 huge. You have to be able to humble yourself and accept that constructive criticism that is going to come, because it's a crazy learning curve going from a unit to transport.
So I heard you say, and I didn't think of this. There's no doc there, and you guys are making the plan. Is anyone like ever on a call or something? Like, are the others that you're arriving to aware of what you're doing on the
Yeah,
flight?
so with IFTs, it's always like the referring physician is typically there. Sometimes they're nowhere to be found. It depends on the facility. A lot of the times, the docs at the referring will be there. Ultimately, it is their patient until we take them on transport, but I'm also, depending on the patient, I do have medical control, which is a physician that I can call if I get kind of stumped on something
Yeah, like whatever you're
potentially.
doing isn't working. Yeah,
Yeah.
I
Or
see.
just kind of like
Okay.
a, hey, we're doing all of this stuff. This is what you're going to be getting. Here's all the interventions that we're doing. You know, right, right. It's one or the other. So, yeah, so you do have medical control. They're just not physically there.
Gotcha. Gotcha. So obviously some of these shifts can be super high adrenaline and can last 24 hours. How do you unwind when you get home? How do you like shut that down?
I've gotten a lot better at compartmentalization over the years, because nursing is very, just, this isn't even true just of flight or transport. This is true of any unit. Um, I think if you let it consume you, it will. And I've had my fair share of very difficult cases, especially when I was younger working in the unit, that I did let consume me. And so I think now, 7 years into my career, I've gotten pretty good at boundaries and just being like, you know what? It is what it is. I did my best. Usually, if it's a really hard call, I usually debrief with my partners anyways, just to be like, hey, what did we do well? What didn't go so well? Even if it's like a pretty simple trip, I'm always like, hey, like, what could I have done better? Did you feel like I communicated well with you? Just to kind of get that rapport and get the feedback, especially if I'm working with someone new, that we're not used to working together. But that's kind of how I'll metabolize the call, is if we debrief about it and we discuss it. But then, when I get home, I let it be, because I can't change anything. And, I always hope and pray I do my best and the patient has a good outcome. Sometimes certain things happen, and I think just like emotionally, some calls are just harder than others, regardless of what happens. Just because I think we're all people at the end of the day, and we all have emotions.
Absolutely.
And I have
Yeah.
definitely cried after work because of tough calls or tough conversations or something like that. I'll never cry at work, ever. Um, But yeah, I mean, I really just kind of let it be. And I don't have a lot of friends. Like, I do have some close friends in healthcare, but I would say the vast majority of my friends are not healthcare workers. And I think that has helped me a lot because we have so much more in common. And it's like for me, I used to be very wrapped up in my career and it was my entire identity. So it's really nice to have people that are close to me in my life that really don't know what I do at work. And that may
You're
seem really
right.
counterintuitive,
No, you're
but for
so right.
me,
Yeah.
to not see me as, a nurse or a healthcare worker or
Right.
whatever, and we can talk about so many other things that have nothing to do with
Right.
healthcare, especially in this current climate,
Yeah.
like has been amazing for my mental health.
Absolutely. I can totally understand that. I feel like if it's not around you, then you're not going to be thinking about it all the time, right? And like having friends in healthcare, it's like you can relate to anyone's situation despite what type of nurse they are, despite
Yeah.
whatever their role is in healthcare. So when you have someone who's completely opposite, it's like you can be you again.
Yeah, and that's the thing. It's like I feel like I have like even, on like my little social media account, I have like Nurse Hens and then I can kind of like shelf that and just be Hensley in my real life. Yeah, it's like I'm also not just this nurse, like I'm like a whole other person outside of my career. And I feel like that took me a good while to kind of really not put all of my value on me as a nurse. And since I've kind of made that mindset shift, I feel like I've become a better human and I've become a better nurse because I'm not doing it for like a self-worth measurement.
Yes, and I feel like that could even sort of hasten in your role because it's such like a high adrenaline, and everybody wants that like trauma, like especially I feel like a lot of new grads they want to go straight, I want level one trauma, like nothing else, and you're there, and you're like, wait a minute, you realize there's more to me here. Like I've reached this goal, but I need to know now that I can step down and be myself.
Yeah. Yeah. And that's the thing. It's like I feel like healthcare workers, a lot of us get really wrapped up in that part of us that it's like, no, like take that away and we're still, we have all these layers
Right,
to
there's more
us
to
that
us.
have
Yeah.
nothing to do with our careers. And I think that's
Exactly,
really important
exactly.
for all of us to remember, especially I feel like post-COVID, it's just been really difficult
Yeah.
for a lot of people, um, emotionally, mentally in the space. So I think remembering that we're people first.
Absolutely. Yeah. I definitely think COVID put a lot of us over, and that's where a lot of us, our flame sort of died too.
Totally. Yeah.
Um, yeah. So tell me, tell me a time when a lot of us can't relate to because you're up in the sky, where something sort of odd or funny that happened to you or a patient.
I always tell this story because I still work with one of my old bosses who's also, I feel very fortunate. I've had a lot of great mentors in my life, in my career. So the company I used to work for, we would also do international calls. So we would go by we call it fixed wing or just like a jet to go get patients from like Central South America, the Caribbean, different places like that are too long range to take a helicopter. So I was still on orientation actually at the time. So it was myself, her, and then a paramedic because on orientation you don't really count as like the lead.
Sure.
Um,
Yeah, I get it. You're shadowing,
so
right?
so we went to Central America to pick up a patient, and we actually had the patient loaded, and we're about to head back to the airport to come back to America. And we get a call from the pilot and said, "Hey, we're having some maintenance issues. You're gonna have to wait." And so we said, okay, so we took the patient back into the hospital and cared for the patient for a couple more hours on all of our equipment. And then they called us back and were like, yeah, actually, we're going to be overnighting here. So we stayed in this country overnight, and none of us had a go bag, which is kind of like your emergency bag with like extra socks and like underwear and clothes and money. None of us had, yeah, none of us had a bag. None of us really had any money. So we were just like, okay, so we're just in this foreign country walking around in our flight suits, like, and so the company obviously like, you know, got us like a hotel and stuff like that and like comped it and everything like that because it was not a planned overnight. Because sometimes they will be planned overnights when they're international calls, but that one was not. So we ended up being there for that was like a 40-hour shift. We were finally able to leave the next day in like the afternoon around like or it was evening. It was like 7 p.m., like something like that. We dropped the patient off like at 1 a.m., basically like 2 days after we had left. It was a crazy time, but it's like that would, nothing like that would ever
Never.
happen in the
Yeah. Yeah, like the most you get is like you're snowed in the hospital, but like you're in a whole
Right,
other country like in
exactly.
your flight outfit and you're like,
Yeah, so we were just walking around and it, like again, I'm like all like bright-eyed, bushy-tailed 25-year-old like this is
the
cool, Like
where
I
people
was
like, can
still
I take a
living my
picture
best
with you?
life.
Oh my God. Did anyone speak English?
So one of our paramedics, he speaks fluent Spanish, so we were able to communicate, which was great. Yeah. But yeah, I mean, we got the patient nice and safely back to the US, so we had a good outcome, but yeah, we still talk about it to this day because, they kind of let me take the lead because I was toward the end of orientation, so they kind of let me like really be as independent as they could really let me. So it was a great learning experience for me, just like as a new transport clinician. It taught me a lot of autonomy because that's something that you have to be comfortable with is autonomy, and treating appropriately these patients because you don't have a doc. But yeah, it was funny, and that's something that I'll remember for forever.
That's pretty cool. You got like
Yeah,
a free
yeah, it
little
was
trip,
cool.
right? Yeah. All right. Can you share with me an experience that completely changed how you see what you do?
I think honestly, yeah, I mean, it's hard to always pinpoint like a singular moment just because I have so many formative experiences from the bedside to the transport world. I think anytime you go on a transport that when you kind of call and get like a patient update and it's just like a very, very, very high acuity patient and we're not really sure, the outcome. Sometimes it's not always safe to transport the patient, but, we just kind of go and do what we can. And when we are able to safely transport that very sick patient, just whenever you kind of get that like thank you from the family, just as being like a small part in their journey is unbelievably gratifying. Like I really could never give back as much as transport has really given me, like those moments of when those families are so grateful to you, like it is very humbling because, I'm just like a small part in the greater in like the big picture. But, because it's like you'll show up at the bedside at the referring and, A lot of the times we have really great staff at the referring that will be very helpful and everything like that. So when you kind of have that full all hands on deck and the family sees, everyone working together and then you successfully get them safely to the receiving and then, you get to talk to the family and say, "Hey, like they're in the unit. They are still on all the things that they were on, but they made it there." You know, just like seeing, hearing like the thank you kind of like for helping my loved one is, I think that always makes an impact on me, on a lot of us. And even at the bedside too, like when you kind of get that thank you, because I think a lot of the times, at least I know I felt this, like nursing can feel like a very thankless job sometimes. So, because I think, we do give a lot. Um, of ourselves emotionally, physically, nowadays, our safety. So to hear a thank you from a family, I mean, like, it goes so far with me, honestly.
Yeah, I
So,
totally understand. Yeah, we're just pouring out, and it's like that one simple thing. But I also, while you're speaking, I'm realizing like you might be a glimpse of someone's extremely long hospitalization
hmm
that I feel like maybe it can be forgotten a little bit, you know?
hmm
Even though like your impact and what you guys do on those flights is imperative to keep them alive, but because it's like that ride and then,
yeah,
there's they're
we're
there
there
for
and then we're not, and it's very easy to
exactly.
forget that we ever existed.
Exactly. Absolutely.
Yeah.
Exactly. Exactly. So I can only imagine like hearing a thank you, especially because you probably miss that a lot. And you don't have the time with these people. It's that short, time, and you might not always see the families, I'd imagine.
Yeah, because that's the thing. It's like they're trusting you to to get them there, and that's the thing. It's like the patients and families don't get to pick us. Like we pick this career, and it's important, I think, to always remember that, to always show up as your best, you know.
So true. So true. So true. Um, so what's something most people don't realize about your job until they do it?
That we're only two people. I think that gets lost on a lot of people. Um, you know, I with these ICU patients, we're managing a ventilator, we're managing specialty gases, we're managing 10 plus drips too. We're two people. And when we roll into a unit with all of this stuff and we're met with about 10 people
Yeah. Right. Yep.
between physicians, nurses, respiratory therapists, sometimes pharmacy is there, sometimes surgery is already there. We are two people and we are managing that patient to the very best of our ability. So I think it's important, for the receiving. And again, there are plenty of people that, can be rude and moody, and I get it. I'm sure I have been rude and moody. We are all people. But I also think that it's important to remember that we, like, there's two of us. That's it. And we're managing all of the entities of this patient. It's for a shorter period of time, for sure, but we are the ones that are implementing these interventions. And I think it's important for receiving, for everyone to have grace for everyone. But I think that you don't realize how much pressure and responsibility you have
I can't
on
imagine.
transport as two
Yeah.
people, as a
As
two-man team, until you've done it. Because
right.
it's really easy to
Right.
look at it and be like, oh, whatever, that's nothing. I promise it is not that simple.
I just want to let you know I've never thought that.
Yeah, right, exactly. Like
Like
most
I
people don't think that. And that's okay. And that's okay.
Right, right. But I can hear you. So it's like having an ICU with an extremely critically ill
Hmm.
patient and only two staff in the unit.
Yeah.
Like that ain't gonna
Yeah.
happen. So yeah. So then throw in some like extremely overstimulating sounds and motions and everything else, and then you get there and you're given an attitude. It's like absolutely, I hear you. Like you most certainly should be receiving grace
And it's
with
not
good
even
team
necessarily like an
trust.
attitude. It's just kind of just important to remember type thing because it's like sometimes I'll get like, we get asked so many questions, especially, I'll give report, I'll do like a big report with it's kind of like a timeout type thing. I'll do like a big report just so I can hopefully answer everyone's questions, but you're still going to get like a million different questions at you, which I totally understand and I that's totally fair. I think everyone's trying to do their best to maintain patient safety, but also we're two people still.
Right, right. So have grace if
Questions and get the patient safely transitioned over because sometimes that's one of the hardest parts about transport. I always two of the two of the moments on transport that always make me kind of like clinch up is when we transfer the patient completely over to our stretcher and all of our equipment. And then when we transfer back over, especially if there's, a ton of drips and everything like that, that's where med errors can happen. That's where things can become dislodged. That's where tubes can come out. So it's really important that everyone's on the same page. And that's why it's like you have to listen to the crew and kind of where everything is and kind of effectively communicate that when you're doing these transfers because those are two of the riskiest parts of the transport is when you're physically moving the patient.
right, right. You would think like it's on a helicopter, but it's actually like
Yes, a lot of times it's actually
wow.
like in the unit.
Yeah, right. Like that's crazy. Yeah, I never thought about
Yeah,
that.
it
That's
yeah, it
interesting.
is because it's like, when it's just the two of you and you've got a good rapport going and you have great communication. So it is still very stressful, but you can kind of like relax into it a little bit because you're like, okay, like we've done this before, we know what we're doing, we have our, protocols and algorithms that we're working with. But then it's like you get other voices and other kind of cooks in the kitchen, so to speak, and then that's where it can get a little chaotic.
I can imagine. Yeah, right. Because now like all hands are in. Yeah.
Yeah, and everyone wants to get the patient over and transferred over, and it's like, okay, like we have pressors going, we have sedation going, we have a paralytic going, we have fluids going, we have blood going. So it's you have to be very like like slow is smooth and smooth is fast. Like it's a very you have to let it flow.
Right. Right. One little thing can really.
And one little thing can make a massive difference.
Right. And especially like you finally get them there after all your work.
Yeah, exactly. So it's like let's go slow. It's sometimes you have to move them faster, sometimes you do. I understand that. But, if the patient is stable and doing okay, you have some time to kind of go through your process, get the patient moved over and kind of let it be. Again, sometimes there are obviously circumstances where you don't have time and the patient is like acutely decompensating and you just need to kind of get them over and let's start working again. But sometimes you can you've got some space.
It sounds like then as a receiver that they should be mostly listening. It sounds like listening is huge.
I think just as long as I just like all of us to be kind of on the same page. You know what I mean? So it's like I definitely just think let's like I hope that like in my report I'm able to answer your questions. I'm happy to kind of fill in the gaps, but it's like the big things that are kind of like patient safety concerns that could happen right now is what I'm going to really kind of go over. If people have other questions, absolutely. Like we're all here for the patient and patient safety at the end of the day. But yeah, I would definitely say just kind of don't when we walk through through the door, don't be like, start asking questions because I'm like, I promise, I will do my best to answer all of your questions. Just let the process work.
Right. Okay, that's good advice. That's good advice for the receiving. especially for nurses out there who are frequently, not in your role, but on the receiving end. So it's important to know that.
And a lot of the time they do. A lot of the time, like I haven't experienced that too much because a lot of the nurses that we give report to, they kind of get the process, and especially in like the ICUs and the ERs and stuff like that, they get the process. Yeah, they're familiar with it. So I feel like I've been fortunate with in that respect that I haven't run into, too many questions right off the bat. So they really do let us kind of go through the process and kind of work with us because again, we all want the patient to be safely in the unit at the end of the day.
Exactly. All right, last question. If you could tell your younger self something on the first day, what would you tell yourself on your first day of work as a transport nurse?
Buckle up, literally and figuratively. It is literally about to be the time of your life. It's going to be the most challenging, emotional, mentally and physically draining adventure of your life, but it's going to be so worth it, and you are going to love it just as much as you hoped that you would.
I love it. I bet there are so many nurses out there who don't feel that
Yeah.
and have also never seen someone who has been so fulfilled
Hmm.
by their role in nursing and still feel it. And that's what I want. I want people to
Yeah.
know and feel through you.
And that's the thing. I think that I say this all the time. I feel very blessed to have found a passion in life so early because I think people can be 40, 50, 60 years old and not feel that about their work. And it makes me genuinely sad because I hope that everyone really does feel the joy. And it's like, listen, I don't feel this way all the time. I really, really don't. Like, it is not linear, which I also think people can misconstrue it as, oh, it's been easy for her. There's been no bumps in the road. And I'm like, whoa, whoa, whoa. That's not true. Um, it is not a linear process, but I think at the end of the day, I can always say I feel very fulfilled by being a nurse, by my chosen specialty, by the people that I've met. I've met some amazing people, really amazing people through my career. I've gone to amazing places. I've had amazing opportunities. Like, I have nothing but gratitude. And, nursing has given me so much, and I could never give back to it as much as it's given me. And I think, like I said, I feel so grateful to be able to talk about it because I think a lot of people are like confused, like why I really do love being in healthcare. I think it's very difficult. There's a dark side to healthcare, but I'm aware that it's there, but I'm not going to stare right into it all the time because no one would ever go to work. So, yeah, I mean, I feel lucky and I'm grateful and I hope that, everyone has a chance to feel the level of fulfillment that I really do feel.
I love that. And I think that hearing your story, people will realize, there's more out there if you're not happy, and
Yeah,
how
there's
lucky we
so
are.
much out there.
Right. And how lucky we are if we do feel that,
And that's the
especially
thing. It's
because we
like
can.
if you're not happy in your chosen specialty as a nurse,
Yeah.
you can do so much. Keep
You
going. Try a bunch of different stuff. Like the road does not end at your first new grad job. It really doesn't. And it's like, don't stay somewhere where you're miserable.
Right. And I think part of it is the fear of change, right? Fear
Yeah.
of change is scary, but until you do it, you will not know. And sometimes things happen well, I think all the time everything happens for a reason. So if
Yeah,
Like
me too.
you're rebooted, you know, like it's time to start fresh. It's time to start fresh. There's no reason, and I hate that a lot of people are afraid because of their pay and benefits, because that can be so difficult, especially when you have a family and you know
Totally,
things
yeah.
like. But you can have both. You can have it. You can have those things. So we're lucky that we have a career where we can really expand and find the right one. And I mean, flight nursing. I mean, it's just amazing. I loved your story. I really, really appreciate it. I think that everyone needs to hear your story.
I really appreciate it. No, I mean, like your platform is, insane. Like it's in like the best way, Like I feel like it's funny, it's positive, it's real, it's got massive reach, and I feel like it gives people, a little bit of, that hope and that swift kick in the rear that I think a lot of people need.